Minnesota Governor Tim Walz has announced the state is beginning to close all but one state-run vaccination site, saying the state has reached its goal of 70% of those 18 and older getting the vaccine. ABC 6 News reporter Rachel Mills joins me in studio to tell us more about if this news means that we're closer to the end of this pandemic. Rachel?
Betsy, local health officials say this news can be interpreted a few ways. State sites closing is a sign of progress, but they say it also means the demand for vaccinations has stalled.
There's not the demand for vaccine. And so having multiple different sites or mass vaccination sites or anything like that just isn't needed. We don't have that many people that want to get vaccinated right now.
The director of Olmsted County Public Health, Briggs, says most people who wanted to be vaccinated have been.
At the same time, I want to respect people that may decide that they don't want to get a shot. That choice is ultimately up to them.
The state health department's director of infectious disease, Chris Erisman, says by closing these sites, they're basically downsizing to match a lower demand in vaccination.
So it just seemed like now was a time to, really wind down this part of our response. We're not seeing as much demand at these sites, and so we want to make sure that we're using resources wisely.
While the state-run sites are closing, Briggs says it doesn't necessarily mean the pandemic is over.
So yeah, part of it is that things are slowing down or ending here, but that doesn't necessarily mean that the pandemic's over until the WHO declares that it's over.
Briggs says someday, when the World Health Organization formally declares the pandemic has been isolated, we can consider this all behind us.
Unfortunately, I don't think I've seen the end of COVID in this county. We probably have just seen the end of the emergency response.
Governor Walz says there will still be plenty of opportunities for Minnesotans to be vaccinated going forward. He says, quote, "We will continue our collaboration with diverse partnerships to equitably distribute vaccines in every community and every corner of this state."
And the sites at the Minneapolis-St. Paul International Airport will still be there through the beginning of August. And once those state-run vaccination sites are gone, Minnesotans can still be vaccinated by their own doctor or at a local pharmacy. Betsy?